All right, welcome back everyone to the deep dive. If you're a UPSC aspirant, glued to those daily current affairs, and let's be honest, who isn't for mains and prelims, well, we're diving deep into something you really need to know.
Today, it's all about this silent threat. It's holding India back from becoming a $5 trillion economy and a global powerhouse.
Yeah, it's a big one, right? We see all these incredible advancements happening, but this rising tide of non-communicable diseases, NCDs, it could really put the brakes on everything. We're talking heart disease, diabetes,
Wow.
cancers.
Respiratory disorders, the whole gamut. And just so we're clear, these aren't the kind of diseases that spread from person to person. We're talking long-term chronic conditions.
And what's scary is they're becoming more and more common, right?
Yes.
So for this deep dive, we're going straight to the source. We're talking the Hindu, and we're going to break down how these NCDs are impacting India, what we could do to prevent them, and how technology could play a role. All those key insights you need for your exams. So first things first, let's get a grasp on the magnitude of this problem.
Well, it's massive. I mean, NCDs are responsible for almost two-thirds of all deaths in India. We're talking 5 to 6 million people every year.
That's a huge number. And remember, all the progress India's made in controlling those infectious diseases. This rise in NCDs kind of feels like a step back, doesn't it?
Absolutely. And what's even more worrying is who it's affecting. We're seeing a sharp increase in NCDs among younger people, those in their prime working years. It turns out that around 22% of Indians over 30 are at risk of dying from an NCD before they hit 70.
Wow, that's alarming. And think about it, this is the generation that's supposed to drive India's economic growth, right? The famous demographic dividend. If a big chunk of this group is getting sick or dying young, that dividend might not be as big as we thought.
Yeah, it's a direct hit on productivity, people missing work, and ultimately premature deaths just crush economic potential.
And when we start putting numbers to this economic impact, it gets really real. We're looking at somewhere between 5% and 10% of India's GDP lost every year because of NCDs.
The World Economic Forum and the Harvard School of Public Health, they've projected that India could lose a mind-boggling $3.5 to $4 trillion between 2012 and 2030 because of these diseases.
Trillions. That puts it in perspective, doesn't it?
Yeah,
It's not just a health crisis. It's a major threat to India's economic ambitions. And it really drives home the point that investing in healthcare isn't just the right thing to do, it's smart economics.
couldn't agree more. It's strategically vital to prioritize prevention. And the good news is that a lot of these NCDs can actually be prevented.
That's huge, right?
Yeah.
And the Hindu really emphasizes that. This isn't some inevitable doom. Most NCDs are tied to things we can control, things we can change.
Exactly. They highlight some key culprits: inactive lifestyles, unhealthy diets, tobacco and alcohol use, and of course, we can't forget about air pollution. All of those, along with genetic predispositions, play a big role.
And the article lays out just how much of a difference we could make if we tackled these issues, preventing up to 80% of premature cases of heart disease, stroke, and diabetes.
80%, that's massive. And one area they highlight as a starting point is obesity. Right now, about 22% to 23% of Indian adults are overweight.
So for our listeners out there prepping for those UPSC exams, what can we actually do? What concrete steps can we take to prevent this?
Well, getting people moving is key. It doesn't have to be complicated.
Right.
Walking, yoga, sports, all those things make a big difference. And promoting healthy diets, lots of fruits, vegetables, lean proteins, that's crucial too.
And it's not just about individual choices, right? The article makes a strong point about pollution control.
Oh, absolutely. The
Yeah.
link between air pollution and things like respiratory and cardiovascular disease is clear. Cleaning up our air is a public health imperative.
Now, the Hindu also talks about catching these conditions early.
Right. Early detection, that's critical. Regular health screenings, starting around age 40 or even earlier if you have a family history of certain conditions.
So what's the benefit of identifying things like high blood pressure or prediabetes early on?
Early intervention. It's about managing these conditions before they turn into something more serious, like full-blown diabetes or a heart attack. The same goes for early-stage cancers. The sooner you catch it, the better your chances.
The article also dives into a really exciting area, technology, specifically artificial intelligence. This feels like it could be game-changing for India.
It really could. We have over 750 million smartphone users in India. That's a huge opportunity to use digital health tools and get information out there.
So what kind of tools are we talking about?
You have things like fitness trackers that monitor your activity and heart rate, mobile apps that give you personalized health advice and track your diet. And then there's telemedicine, which makes healthcare more accessible, helps people manage chronic conditions, and makes better health decisions.
It's all about giving people the information and the tools to take control of their health. But let's talk more about the AI side of things. How can artificial intelligence help us tackle these NCDs?
AI can be a real game changer in two ways: predicting risks and improving diagnosis. AI algorithms can analyze mountains of health data to figure out your chances of developing specific NCDs. That means you can get personalized risk scores, which helps target preventative measures.
So it's like an early warning system for NCDs, right?
Yeah.
Predicting risk before they become a problem.
You could say that. And when it comes to diagnosis, AI can spot those tiny anomalies in medical images that might be hard for humans to see consistently. For example, finding those early lung nodules on an X-ray or signs of fatty liver disease on an ultrasound.
That's pretty incredible.
Yeah.
But the Hindu does point out that we can't forget about the human side of healthcare.
It's a point worth stressing. Technology and AI are powerful tools, but the human touch remains absolutely essential. Preventive care has to be compassionate, accessible, and truly patient-centered. Technology should enhance that human connection, not replace it.
So it sounds like we need more than individual actions or fancy technology to address NCDs. We need a fundamental shift in how we view health and well-being as a society.
It's about creating a culture of prevention, a health-first philosophy that goes beyond the doctor's office and touches every aspect of our lives.
The article talks about different stakeholders and their roles in this shift,
Yeah.
starting with individuals, right?
Yeah, personal responsibility is the foundation. It's about making informed choices, going for regular checkups, making small changes like cutting down on sugar or taking the stairs instead of the lift.
And what about the role of workplaces?
Workplaces have a big part to play in promoting employee well-being. Things like annual health screenings, access to counselors, even encouraging fitness activities at work. A healthy workforce is a productive workforce.
What about healthcare providers? What needs to change there?
The focus needs to shift from reacting to illness to preventing it in the first place. It's a mindset change, and it means prioritizing resources for preventative care services.
And public policy can shape the environment to make it easier to be healthy.
Exactly. We need urban planning that prioritizes green spaces for physical activity. We need good nutrition and fitness education in schools. And maybe even regulations on things like salt and sugar in processed foods.
The Hindu does mention some government programs that are already in place, right?
Yes, initiatives like the National Program for Prevention and Control of NCDs and those health and wellness centers are steps in the right direction. The key now is to scale them up and weave them into a broader national strategy that puts prevention at the heart of healthcare.
But to bring it all together, it's clear that getting a handle on this NCD epidemic is absolutely crucial if India wants to achieve those ambitious economic goals and become a major player on the world stage. This is a big takeaway for all those UPSC aspirants out there.
No doubt about it. Shifting towards a preventive healthcare model isn't just a good idea. It's essential if we want to protect India's demographic dividend and, more importantly, the well-being of all citizens.
It's a shared responsibility. Individuals, communities, corporations, the government, we all have a role to play in creating this culture of prevention and using technology responsibly to support it.
Absolutely. Working together, India can overcome this challenge and build a healthier, more prosperous future for everyone.
And on that note, here's a thought for you, our listener. As a future policymaker or just an informed citizen, and especially as you're studying for your UPSC exams, what innovative policies beyond the existing programs could be most effective in building that nationwide culture of prevention? Think about that, and as always, if you found this deep dive from the Hindu helpful, hit that like button, subscribe to our channel, and leave a comment with any questions you have. Till next time, thanks for diving deep with us.